Hello, I'm Dr. Foster, and today I'd like to introduce you to a revolutionary strain of probiotic bacteria that can transform your digestion and change your life. Well, it's no surprise, intestinal health has been steadily declining, and along with this decline, there has been an increase in chronic diseases. By testing the urine of people with various health problems, Dr. William Shaw found a correlation between certain diseases and a buildup of organic acids in the urine. Now, where were these acids coming from? These acids were actually being produced by harmful bacteria in the intestines, a sign of gut flora imbalance. These diseases included autism, Rett syndrome, seizures, child psychosis, chronic fatigue syndrome, colitis and Crohn's disease, migraine headaches, autoimmune disorders, lupus, Tourette syndrome, attention deficit disorder, depression, Down syndrome, fibromyalgia, and pervasive developmental disorder. Now, most of those are serious diseases, but most of us experience common everyday problems that are caused by gut flora imbalance. And those include bloating and gas, digestive problems, constipation, and the opposite, diarrhea, and alternating back and forth, irritable bowel syndrome, skin breakouts, lactose intolerance, lack of energy, chronic inflammation, chronic pain, Candida overgrowth, yeast infections, and even bad breath, and more. Now, a lot of us know we have a gut flora imbalance, and we've tried to do something about it. Unfortunately, doing the right things may not always work. Many people have found that their digestion and well-being have suffered after a round of antibiotics. And after numerous attempts to replenish their good bacteria by doing the right things, such as eating yogurt or taking probiotics, it's usually not successful. What most people do is take products with super duper multiple strains of bacteria thinking, more must be better, right? Well, no, wrong. These strains actually compete with each other, often canceling each other out. Then they produce only weak amounts of the wrong type of lactic acid, and most don't even survive stomach acid or the overly alkaline environment in the gut. So what does work? Well, we found there are 4 steps involved in determining whether or not a probiotic will actually work. To build a strong foundation for a clean and healthy gut, and begin a bacteria replacement program, a probiotic must be able to perform 4 steps. 4 crucial steps. A probiotic that can perform the 4 steps helps establish a clean ecosystem for healthy growth of gut flora. A probiotic that cannot perform the 4 steps will be less effective, leaving a person to wonder, is this probiotic working or not? The 4 steps are viability, survivability, growth, and production of L+ lactic acid. There are many types of lactic acid, but the most important one is L+. So what are these 4 steps exactly? What do they mean? The first step, viability. This means, is the probiotic actually alive when you take it? For example, acidophilus and other common probiotics are actually quite fragile. They die easily at room temperature and they cannot survive on the store shelf unless you refrigerate them. Now, this is a guarantee. If your probiotic is dead before you can even take it, it's definitely not going to work. Now, the second step, survivability. This means once you've put it in your mouth, can the probiotic survive harsh conditions inside the body, such as stomach acid or bile acid? And now the third step, growth. Can the probiotic grow in a state of dysbiosis? Dysbiosis is gut flora imbalance. How does this happen? Well, poor health or taking antibiotics causes beneficial bacteria in the gut to die, so they can no longer produce their lactic acid. Lactic acid is what protects the gut against invaders, such as yeast and bad bacteria. This loss of good bacteria turns the gut to alkaline. Alkaline is the opposite of acid. So now you're vulnerable to many types of infections and inflammation. Unfortunately, common probiotic bacteria cannot survive in this new pH, so it's not as easy as just putting it back in. Even if you can get it past stomach acid, and even if you take enormous doses of acidophilus, Lactobacillus, or bifidobacteria, it's not going to grow in the gut, nor is it going to produce lactic acid. And the fourth step, production of L+ lactic acid. This means, can the probiotic produce not just any type of lactic acid, but L+ lactic acid specifically? There are many types of lactic acid, and some of them can actually build up and cause harm. So this is the reason why it's important that the probiotic produces the L+ form. Now, surprise, surprise, acidophilus produces a D- form that can accumulate and harm the brain, the main reason why it cannot be taken by infants or the elderly. So we're looking for the L+ form. This is the type that is the easiest for the body to break down and the easiest to utilize. Whereas for the past 30 years, all of the standard probiotic companies have been working on steps 1 and 2, viability and survivability, we're not concerned about these. Why? Well, Bacillus coagulans has its own natural defense mechanism. This protects it, so we don't have to worry about whether it will survive on store shelves or survive stomach acid. We're focused more on the most important steps. Steps 3 and 4, growth and production of L+ lactic acid. Getting a probiotic past stomach acid is only half the battle. Getting past steps 3 and 4, growth and production of L+ lactic acid, this is what determines which bacteria will survive in the gut and which bacteria will die. Our unique program can effectively accomplish these 4 steps where standard probiotics cannot. But wait, there's more. Although doctors have been using this strain since the 1960s in Asia, hardly anyone in the US has heard about it. Their clinical trials have proven its effectiveness for constipation, diarrhea, yeast infections, and many other GI tract issues. In fact, it's one of the best kept secrets to come out of Japan. Additionally, in the year 2000, after much experimentation in the US, we made the amazing discovery that this probiotic has an even stronger ability to overcome gut flora imbalance and inflammation if combined with a specific type of highly concentrated aloe vera. This aloe allows this probiotic to penetrate deep layers of the intestinal lining where bad bacteria and yeast have their roots, to help it delve to a deeper level than any other probiotic has ever been able to go. And in addition to that, we found the perfect synergy between these two substances, allowing us to formulate a truly unique product that can be used both topically as well as orally. This combination allows us to go beyond ordinary probiotics, taking us to a higher level of healing the gut. This is the 90-day bacterial replacement program. By changing the pH environment in your gut, you can bring your flora back into balance, and doing this can change the way your entire body functions. So take the 90-day challenge and make a big change in your life with just 2 products, Flora-G Plus and Can-G. To learn more, visit us at drfostersessentials.com. And thanks for watching.